Hey patient,
Hello.
do you have a strong muscle? Yes you do. Let's see. Hey knee, how you doing? Not so good. Hi, hey knee, how you doing? Better, thank you. Hi, this is Dr. Lisa Gordon. I'm here at my office at the Natural Health Improvement Center of Columbia, Maryland. And I do have another video about how I do knee adjustments. And I've just been thinking about it because a lot of people really don't like a more vigorous knee adjustment. And there are very gentle ways to adjust the knee. I wanted to show you what a very gentle knee adjustment looks like. As you know by now, I use muscle testing for just about everything. So I'm going to say, hey patient,
Hello.
do you have a strong muscle? Yes you do. Let's see. Hey knee, how you doing? Not so good. Hey other knee, how you doing? Also not so good. So this is a patient whose hips I've worked on over time and whose ankles I've worked on, and we can see that her hips push are really doing great. And so as we know, things are all connected, and so now it's time to work on knees. And what I'm going to do is just have you watch me go through how I do this. A lot of this you might not understand, but I do want you to know that what I'm checking is where the problem is and which direction I need to adjust it in. So where would these bones be more comfortable? So push, more comfortable. Push, less comfortable. Push. Now, I know that about her knees, and what I want to do is also check the muscles that hold the knees up. So put your arm down for a moment. I'm going to be checking other muscles. Bend your knee. Take your hand off your body so your body knows what question we're asking it. We're not asking about its stomach. We're asking about the quadriceps. Match my pressure. Now look, her body doesn't know what to do when it even tries to go upstairs. Push. She can't hold that up. Now her leg is stronger than my arm, so she should be able to do that. Bend this leg. That one also isn't holding up. Now the thing that makes me worry about that is that when the quadriceps are not engaging, when we're requesting that they do so, they're also not engaging when she's going up and down stairs. Therefore, her knee joints and her hip joints would have to take up the stress, and that could be a problem. So I'm going to check a few more muscles and hold this leg up, but straighten it and turn it in. Push your leg up this way. That muscle is nice and strong. How about on this side? Hold. So the side muscles of her legs are nice and strong. Put that down. Now how about if we bend this leg, bend it at the knee and drop it out here, hold it here, and I'm going to do this, push. That's a muscle that holds the knee up too. It goes like this. It's the longest muscle in the body. Bend this one and drop it out and push. Now that one's not strong, so we've got to recheck that. Okay, so let's go back to adjusting those bones, and we're going to see if just adjusting the bones, realigning them, push in chiropractic terms, will help strengthen those muscles. And I'm just going to use this very gentle instrument that sounds like that. And I learned something about the direction in which it needs to go when I was muscle testing her before, and I'm taking that information and adjusting it appropriately, and now she can hold her arm up as an indicator when I touch her knee. Push. Hi, hey knee, how you doing? Better, thank you. All right, let's see if that corrected. Push here. It did. Bend your knee, push. Okay, now we haven't done anything to this knee, so it's still weak, the quads. So let me remind myself which direction. Push. This one needs to go. All right. Okay. With the combination of her knowledge about her body, her innate intelligence, and my 35 years of practice and knowing what to do with this information. And now, watch. Touch the knee. Hey knee, how you doing? Push, press on the arm. Much better, thank you. Now, let's see, we had 2 muscles on this side. You can put your arm down. Bend your leg, push. All right, now that's not quite finished yet. I'm not happy with that. Drop that out, push. This one's push nice and tight. Okay, we're not done yet. That's not good enough. So, what I need to do now is find out, could this possibly be related to her lower back? Jen, would you put your hand under your back? I'm going to show you from this direction where to put your hand. The vertebra whose nerves, the nerves around which, go to the knee. And I want to see, is it possibly related to her back? Push. Okay, keep your hand there, bend your leg, put your arm down, and so relax that a little. I have to adjust her back. Hold that here and push. When she touches that, her leg gets strong. So what I'm going to ask you to do is just sit up for me, Jen, so that the nerve flow from the back can go to her knee muscles. Push. There we go. Drop out. Sartorius is good too. All right, so that's a very gentle way to work on the knee, and now I feel very comfortable with her going up and down the steps at her house or wherever she has to walk up and down stairs, and her knees are going to be safe. They'll also feel better. All right, very good. If you have any further questions, you can comment below. You can call my office. I'm available. I want people to be healthy.